Today, a 59-year-old lady has approached me. She has been suffering from both knee pain for the last several years. This knee pain has increased suddenly over the last fortnight. She had an accident about 20 years ago in which she injured the right knee. However, she has developed knee pain in both the knees over the course of time. This knee pain is affecting her walking. She was very scared of undergoing a bilateral knee replacement. She has seen a few cases where there was lack of success, and so she has come to me today. I have examined her, investigated her with 3 Tesla MRI scans, and I have advised her to undergo SVF therapy in Chennai. She has consented for it, and I will now introduce you to her. You can listen to her story. When people are affected with knee pain in middle age, they have a dilemma before them. They are really too young to undergo a knee replacement, but however, if the situation warrants it, durable knee replacements are available. But in Chennai, India, when people ask around about the results of knee replacements done elsewhere, the people who undergo knee replacements tell them that they are still suffering. They have not been able to dismiss their cooks. They are still unable to walk independently and all that. So they get disillusioned with knee replacement and seek alternate solutions. The lady in front of me is in the same boat. I'm going to introduce you to her. Her name is Mrs. Mayuri. She lives in Chennai. Namaskaram, Mrs. Mayuri.
Namaskaram, Doctor.
Tell me about yourself.
I am an astrologer, basically, but due to knee problem, severely, my profession got affected. So I closed my office and all, etc. But this knee problem it is not at all. It's if it will go next day, tomorrow and all. I was thinking like that, but it never happened like that. So it was going on. I met you. So after that, I have got big confidence within me. So everything will get all right, and then I can lead a happy life. I cannot walk for 1 hour also continuously. Even if I sit for 10 minutes, afterwards, if I get up, no, the severe pain will be there. So, and like that, even I cannot travel anywhere, even in car also 10 minutes. Afterwards, severe pain. So like that it is going on. All other doctors are mostly knee replacement only, everybody suggested. So I was apprehensive about the total thing itself, procedure itself, about the knee replacement. And so I have to put up with this pain, and I have to live with that only. I was thinking I was depressed, etc. But after I met you.
Before coming to see me, how did you, what else was your experience? You consulted other doctors also?
Yeah. Many doctors. My experience is I was not satisfied. Mostly.
What did they tell you? Did they give you any
They give medicines to intake, because I have jet problem. I cannot take medicines.
Painkillers.
Not only painkillers.
Nothing.
That other vitamin supplements also. That actually again the jet problem came to me. So I cannot prolong with that. Even if I take supplement also, the question is how long we have to take the supplement. That is the question mark. So we don't know. It will not work or no and all. Not they told. As they told, I took for some time the supplements also, but it didn't work out.
Did you have any other treatment?
Yeah, I took the hyaluronic injection.
Hyaluronic acid injection. That is supposed to be a lubricant.
Yeah. That I took.
What was the result of that? How many injections?
Nothing. Only one injection I put. but nothing happened. Before that, how my knee was. After that also it was like that only. No change, no improvement. But no pain increased. Nothing. Everything was the same. So, and recently last week I did some household work due to the festival, Krishna festival. So at that time it got aggravated much, and pain is severe. So I cannot tolerate. So that is why I came to you. And you said you give valid thing. Advices and how to come out from all this and all. So I was very much impressed, and I am happy now.
So I have done X-rays and MRI scans. You have undergone a 3 Tesla MRI scans.
Yeah.
Many people will just take X-rays, but this 3 Tesla MRI scan has thrown up some very valuable information.
Mapping, doctor?
Cartilage mapping.
Yeah, you did that cartilage mapping. That is first time I did.
This
is the first time.
For you?
Yeah. Nobody told that. Like mapping and MRI, I didn't take at all.
No, cartilage mapping. No. What does the report of that cartilage mapping tell you?
Diffuse knee cartilage, yeah.
Loss.
Yeah.
And then on top of that, what else is there?
That is second to third.
No. Grade 3 to grade 4.
Yeah.
What about the edema, swelling inside the bone?
Swelling inside the bone is well indicated in both my knees.
Both your knees. In the femur bone as well as in the leg bone.
Yeah. Earlier I had one trauma in my right knee. 20 years back, one trauma. Due to that...
there is a loose fragment.
Yeah, one fragment is there. In that also the edema is there.
Edema is there.
So because of that, it has only through MRI I am able to see all this. Or otherwise with X-ray, not clear.
What procedure have I told you that will help you?
Yeah, you said that some fragment or something.
No, fraction.
Fraction.
So I will just...
It is a new one.
I told you about it, but let me refresh in your memory. We talked about it day before yesterday.
Yeah.
And the procedure which I told you was SVF therapy.
SVF, yeah.
So SVF is an abbreviation for stromal vascular fraction.
Yeah.
So this means there is some tissue which has got blood supply with blood vessels in it.
Okay.
And this tissue has got some cells also. The cells are capable of repair and they will repair. But to support these cells, we have the surrounding structures also, surrounding tissues like blood vessels, growth factors and all that. So I will be taking this from your own body. I have told you that I'll be taking it from your fat, not from bone marrow.
Okay.
Because fat cells are more powerful and more in number than bone marrow. And then I will also be taking blood from your vein and preparing platelet-rich plasma with it, mixing the two, and I will be injecting it into both your knees. In addition, because we have seen with this MRI that there is swelling inside both the bones, the leg bone and the thigh bone, I will be injecting platelet-rich plasma. So hopefully you should get relief from it. It is planned as an outpatient procedure. Procedure will be done under local anesthesia. I have given you the instructions and you have understood it clearly. So I hope you don't have any fear about undergoing this procedure.
I am very clear, doctor. Only thing is the medical terms which are I am not able to repeat it. That's all.
No problem.
But I am clearly understood whatever you said.
Okay.
And how the procedure and how it is going to help me in future, in long term, so that I can avoid knee surgery, like that, everything. So I am very happy with the whole thing. Because what I heard is in some places only stem cell or PRP injection. But your thing is totally different. you are in a different position. I think in Chennai you are the only one doctor performing all this, I think. I did not hear anything about this at all, totally. And from you only I am able to hear all this. This is a new kind of treatment.
Yes, it is a new treatment, and the results are there. I have patients who are doing well after 6 years, 7 years, and all that. You've seen many videos on YouTube.
Yeah. Yes, doctor.
If you have not, I request you to go and refer to them. There is one Mr. Jairam Rao, then Balasubramaniam. Many patients are there.
Yeah.
Ranging in age from maybe 30s to 80s.
That is true.
So these people have done well.
Yeah.
You can see her walking now. Coming downstairs is difficult, huh?
Yeah, definitely. Definitely.
Wrong.
Up is better.
Downstairs is painful, huh?
Yeah, painful, and also I am very much apprehensive about that.
Okay.
That keeping my step down.
Okay. Sherry, one, please come.